Let's shift gears. I mean, we've talked about the public health approach, and that is absolutely critical. But WebMD has been a digital leader for more than 20 years in providing individuals with information on their health. So let's discuss how personal health is impacted in this time of COVID-19. If someone's showing symptoms, what steps should they be taking to care for themselves, and when is the right time to seek more advanced medical treatment?
Yeah, the symptoms can be confusing. They can be very similar to the flu or influenza. But in general, what we've been talking about is fever. In elderly, it might only be 99.6. In older people, in younger people, it tends to be higher. Cough traditionally has been a component of coronavirus. It's usually a dry cough, not that you're producing a lot of stuff, and then shortness of breath. But we've even heard, in the past 2 days about loss of smell could be an early indicator. And I talked to a lot of patients on Friday by phone who were worried and are more vigilant of their symptoms. And it's also allergy season as well. So some people could be starting to develop similar symptoms. But what we're telling people is to call your doctor, to call, your local hospital or health department before you go in. Because if you are infected, you could be infecting other people while you're waiting. If you're not infected, you could become infected by going to the hospital, but you definitely want to call your doctor. If you're short of breath, that is a very serious symptom and you need to seek care, but you want to call ahead of time to let them know. Or if you call 911, you want to make sure that you make them aware of it. Otherwise, it's typical as it is for influenza. It might be taking some fever medicines such as acetaminophen or Tylenol. Sometimes people have some joint and muscle pains. It's about drinking fluids and rest, and then monitoring your symptoms and really knowing when it gets more concerning, particularly if there's shortness of breath. If you develop chest pain, that's something different as well. You don't mess around with that. You still call 911.
Are there any extra steps that we as people who have older parents should be taking to take care of people with either underlying medical conditions or people over the age of 50, 60, 70?
Sure. You want to make sure if you have underlying conditions, you continue to treat those well. So if you have asthma, you might want to be making sure you use your daily inhaler. You want to make sure you have enough medicines. If you have high blood pressure and heart disease, there's lots of patients that don't take their medicine every day for a variety of reasons, but now's not the time to be missing those medicines. I was talking to some endocrinologists, some diabetes doctors the other day, and we still talked about it's important to keep your blood sugar under control, but let's be honest, this can be a stressful time. So, you can be a little more lenient. That doesn't mean don't take your metformin or your insulin. You still need to do that, but maybe you're not going to be, as super meticulous about it. But you need to still treat your underlying medical conditions, and that's an important point. And then, as we've talked about, good hygiene, making sure that you clean and disinfect surfaces. And, you want to look to those sources for good information. Every piece of our content is reviewed by a board certified physician. We talked about that I get frustrated by everyone's an armchair epidemiologist nowadays. Everybody is an infectious disease doctor that are espousing medical advice, and sometimes it's wrong, and that does a disservice to folks. And we've been seeing how people are talking about supplements that are going to cure it, and that's not true. Or hold your breath for a certain period of time, and that'll tell you if you have coronavirus. That's just nonsense. But people are seeing that all across social media. Just because someone has a blog doesn't mean they're an expert, and just because they're posting something doesn't mean there's accuracy to it. You want to go to the CDC website, WHO, our own site, which we're very proud of trying to provide the best information out there. And you want to look for that consistency of information too. Does that sound right? Or other people talking about it, because everybody wants a solution right now, but you also don't want to do something that's going to put you at greater risk. And again, you have to manage your underlying conditions as well. And that can be hard, because when you're home, you might not eat as healthy as you'd like. It's hard to be, as physically active. I don't monitor my steps a day, but I'm sure they're fewer than they, typically are, walking around an office, walking around in the city. So we need in some ways to put forth that extra effort